So BioNext Challenge is going to be a series of events and workshops, and we're trying to make sure that it's a light touch for those that are interested in pursuing this as you continue your studies or you have ideas and you want to think about, what can I do to commercialize a medical technology? Technical difficulty, just trying to. Anyways, BioNext. The great thing about BioNext is being a medical technology incubator in London at Western that has all of these great historical events that have occurred within London with respect to medical technology innovation. It's important that we have this space. We want to support those that want to pursue innovation and trying to create companies and trying to create the next best solution for a problem in the healthcare system. And we've got sponsors. So I got to spend a lot of time on this slide because they have funded us to make sure that as you go through this program, that you get prize money. We want to train you, educate you, and allow you to put your best foot forward to create a business plan and a pitch so that you can be part of the finale in March. And I'll show you the itinerary in a moment so that you can get some money. So a lot of our partners, and this is just a smattering. We work with the hospitals, we work with different faculties in the university, different partnerships all over that allow you, if you walk in our door and want help, we will find, if we can't help you ourselves, we will find the help that you need. So you're just getting off the ground. You don't know how to start a business, right? And you've got a few people that you're working with, and you've got this great idea. Well, what does that mean? Starting a business can be complicated because you want to understand who are going to be the shareholders of the company, how are you going to structure it, how are you going to develop a business plan for it, and how intensive is it? If it's a drug that wants to compete with Humira, we're talking billions of dollars. If you're talking about a small medical device or just a small clinic, these are things that have different budgets and different quantums associated with them, which requires a certain level of business acumen to create the plan so that you can attract investors or partners and move your technology and ideas along. And the reason I bring up partners is because they're important. You can lean on them, and you can lean on them through us. So what is BioNext? We want to be a recognized hub for medical technology innovation. We want to create an ecosystem that fosters entrepreneurship and support. We're in London, Ontario. I see a Pittsburgh Steelers fan here. That's problematic for me. I'm a Bills fan, so I might not help you out. But for everybody else, we want to make sure that the ecosystem is working, and the people that come before you are here that can help you figure out some of the problems that you're facing. And we have a lot of resources with respect to all the different aspects to commercializing a medical technology. And so, not to belabor this slide, there's a lot of words, but access to infrastructure, to people, facilities, opportunities, to investors, to understand where you can raise your first amount of money to move your technology forward. Do you need prototyping? Do you need to understand the regulatory environment that you're in? And I can tell you, 2 out of 3 of these people can help. So, Tom, that was a joke, by the way. Tom Chimmel out in the back. Thank you, Tom. He's right there, just so name to a face. Best fabrication specialist, bioengineer, knows how to create prototypes. We've got facilities here at no cost. Barbara Murray, right here, clinical trials manager. She understands regulatory, what it takes to get something into the process, to get that approval, to get into market. So, and this is at no cost. So I also want to plug that I also host these monthly Life Sciences London virtual meetings. So you don't have to come in person. It's the first Thursday of every month at 9 a.m. We do a roundtable of introductions, and then we have a number of companies, whether they're support systems for funding, whether it's companies, whatever, showing up to them allows you to get connected into the network, and the network effect helps and works. You never know who's going to help you out and where you can lean on other people to help move your technology or innovation forward. So in terms of existing relationships and engagement at BioNext, you know, we spend a lot of time making sure that we're connected to investors, we're connected to tech transfer offices, to other universities, whatever it might be, so that if you pick up the phone and contact me, Barbara, Tom, we know where to send you if we can't solve the problem ourselves. So just wanted to let you know about that. The value, we attract funding, connections, economic development, increase clinical trials here in the city, and keep the companies here in London. There's a lot of medtech entrepreneurship that occurs here in London, but in the last few years I've witnessed, they tend to go to other places, whether that's Hamilton or Waterloo. You know, we're better than them. Stay here. We've got better resources and we're going to help you out. So just sending that message along, but don't say that to Waterloo or McMaster that I said that. You want to learn about events that are occurring and about this event particularly. We want to learn more about entrepreneurship in medtech. We've got a number of companies here today, and I see, did Matt roll in? Way to go. Did you speed? Did you get a ticket?
Yes, no.
I don't know what that meant, but thank you. You made it on time. So we've got 3 panelists that I'd like to invite now to the front, and I've got a number of questions for them, and I will open it up to the floor after I've asked a few questions about what their journey has been, starting their companies and the trials and tribulations that they've gone through. So you have a bit of an understanding of what you may have to go through, but you have the help and you have the support, and BioNext is here for you, and so are all these panelists. So thank you very much. Oh, and just one final thing. This is a series. So we're trying to make it easy for everyone who wants to get involved in entrepreneurship and med tech innovation. So this is the inaugural first event. If you didn't make this event, it doesn't mean that you have to be excluded from all the other events. These are on our website, and there's different series talking about, you know, how do you figure out market product fit? How do you create a business plan? How do you create a pitch deck? And it all culminates into a fantastic finale pitch competition where you can win money. So we hope that you all will come and join, and the website's here. but I need to turn this over to Barbara to get the Zoom. So forgive us, we're just going through the first iteration of using this Zoom link and no, you're gonna have to use this as the mic.
Okay.
Nice. Bit of a delay. Nice computer. Sunburn. Well, yes, I sped. No, I didn't get a text message.
So, you're gonna have to use it like a.
That's fine.
Right. So to forego the whole having to describe the bios of our panelists that have done an exceptional job of getting their companies off the ground and succeeding, and some in revenue and some still raising capital and what have you. The first thing that I'd like to ask is, tell us a little bit about yourself. So your resume, but in your words, and what inspired you to pursue entrepreneurship in the medical technology field? How did you identify the specific problem in healthcare for the technology that you're addressing? And what were the turning points that made you commit fully to being an entrepreneur and developing your technology? Now, hopefully that wasn't too many words.
More questions than one.
Who are you and why are you doing this crazy thing? And we'll start with Asha.
Hi, everyone. My name is Asha Parekh. My very brief bio is that I did biomedical engineering right here at Western, completed my PhD, went on to do a couple of postdocs. One of them was a medical innovation fellowship, and that is where I met my now co-founder and business partner, and kind of where it all started. But we actually developed the device that is now in our company the following year. I already forget all the questions, Justin. Why am I doing what I'm doing? I mean, what actually was the turning point for entrepreneurship for me literally was this specific project. I did not have an intent to become a medtech entrepreneur at all before this came about. I was involved in several medical device products, taking them to various stages. This is the only one that made me think about taking that leap, due to where it was, but also mostly because of the potential impact that it would have. I knew I always wanted to do something where I felt like I was giving back. This presented an opportunity. At that point in time, we got the prototype to a point where we could say, and I pardon my language in advance, but it was like a holy shit, this could work moment. And, that was the turning point of, if we're going to do this, we need to have more dedication than us just doing it as our side jobs or after work type of thing. You need a commitment, and that's what made me take the leap, amongst other things. I don't know if I missed something in there, but I'm sure it will come up later, so I'll pass it on.
No, I think that was a great answer. So Saumik?
Okay, I don't know if I can beat Asha here. Nice to meet everyone. My name is Saumik, co-founder, CEO of Tenomix. Similar to Asha in the way, I did a background in pathology and lab medicine. Did my PhD just next door. And I would say for me, how I got into entrepreneurship or just medical innovation, I have described these events as these black swan events. And for those of you that know what black swan events are or don't know what they are, they're basically these like super high probability or high improbable events that you can't predict for, and they just change the trajectory of your life. So for me, I had two events. Younger brother grew up mysteriously with a missing tibia bone. That's the front bone in your leg. He's 2 years old. We had to basically take him to Toronto Sick Kids. And the head orthopedic surgeon had to do this innovative surgery where they basically made a new tibia bone grow over many years. So I was around the age of 7, 8 when I had to explain complex genetic research to my parents, who were immigrants to Canada at the time. So from there, I was like, oh man, this is amazing. Combining medicine with translational aspects of the work that that surgeon did. And fast forward a couple more years, I saw the lack of medical innovation, and that caused the death of my aunt from improper colon cancer staging. So I told myself around 15, 16 that I really want to study pathology and understand disease mechanisms, that hopefully one way I'll be able to contribute back to medical innovation. So fast forward, PhD's finished. I did the medical innovation fellowship program like Asha as well. And I met some of the brightest people ever. My CTO's in the back doing work, which I probably should be doing work, he's waving. But basically, as when we were identifying different clinical problems, we were interviewing clinicians left, right, and center. And one of the problems that came up with this was this issue in finding lymph nodes in surgically removed colon cancer tissues. And worldwide, what's happening is people are using their hands. They're searching through these massive samples of fatty colon cancer tissues. And it's a super unreliable process, and it can cause inaccurate cancer staging for patients. So we found out about this problem along with 177 other needs. And we really had to streamline or filter through all these clinical needs based on a list of constraints and objectives. And we're filtering through all these different needs. One of the objectives was things that we'd love to work on. I was a bit biased because I love to work on pathology things. I don't want to work on an earwax project, for example. So I scored it a little bit higher. But the current project that we're on, and I remember just doing thorough business research on the market space, the competitive landscape. Is this a real problem? Is this a London-only problem, or is this a worldwide problem? So after we've done all these different interviews, we're like, oh crap, that holy shit moment, like Asha said, this is a common problem. And I remember in January 2021, my CTO put together the initial concept of what we're calling the lymphinator, and I'll explain what that is in a bit. And I remember seeing that drawing and right away thinking, Mike, you might not realize this right now, but this is going to have a huge impact in the pathology space. So internally, I sort of committed to the idea. But after the program finished, that's when we sort of really went full steam ahead and started the company. And essentially what we're really trying to build is a novel benchtop robotic scanning device that uses ultrasound imaging and AI. And we're trying to automate this manual, inconsistent lymph node search process for colon cancer tissues. So I think those were some of the questions. I probably missed one other, but yeah.
No, the conversation will continue, so no, that's perfect. I just want to make sure that everybody knows where you came from, where you started, and then we're going to dive in deep to some really serious and maybe personal questions.
Okay. What a lead in. So my name is Matt Bellia, and unlike the other two founders, I actually don't have a background in anything medical or really science-based. My first undergrad was in business administration, then got a postgraduate diploma in ethics through the Department of Philosophy here. And then I returned to Western about 2 years later after working in industry to get a specialization in accounting and finance, where I worked in 10 years in the accounting, consulting, and hedge fund world. My foray or opportunity actually came on the dance floor of my wedding when my co-founder and childhood best friend asked me if I wanted to start a business. The hedge fund I was at used to buy, value, and then sell debt, which is just as exciting as it sounds. So I was super intrigued. We took about 6 months, sort of put things pen to paper, and we had an opportunity to go out west and pitch our idea to some potential shareholders. So the impetus of me jumping in full time was they thought it was a good idea, that we had some issues, but they one of them specifically looked me in the eye and said, if you're doing this part-time working at a hedge fund, there's no way I would ever invest. So if you're not going to go all in, how could I go all in? So that was kind of an aha moment. It took me all of about 45 minutes to decide that I did want to do this. And what we did is, so Alex, my co-founder, childhood best friend, business partner, has a lot of different ideas. He's a very creative, very visionary type guy. And on his Olympic journey, when he was training for the Olympics, he found a certain school of thought which stimulates the nerves in addition to a corrective orthotic, which is very cool, and it's a very German school of thought. And our challenge was, how can we commercialize that, sort of navigate the regulatory scope here, and how do we actually make money? So the first application we thought was, we're going to sell to other pro athletes. There's a marked increase in performance that we can show and we can prove. Pro athletes love to use our product. Pro athletes don't pay for anything. So that's not really a viable business. So then our challenge became, okay, what does the landscape look like in Canada? How do people get orthotics? Why don't people get orthotics? And what our business very quickly evolved from being just solely product focused was we became product and service focused. And what we did, and why I was coming is we developed a mobile on-site clinic where we break down the barriers for accessibility and obtaining our device. So in parallel with our product, we developed this mobile clinic service. Did I hit all of them?
I know.
I think you did.
Now I can keep going. So.
No, that's amazing.
Okay.
It gives everybody a great background as to where you guys got started. And so, you know, with respect to that, you found a challenge in the medical system. You decided to pursue it despite the best efforts of your parents and your friends and everybody else. And you kept going. So what are some of the challenges that you faced early on in terms of getting this going? So let me be even more clear. So you have an idea and you're working with a doctor or someone who has developed a concept. And now you want to embark on being unemployed. So you got no way to pay your bills, and you're gonna pursue this despite everybody telling you you shouldn't, and you did, and what did you do to overcome those hurdles in terms of starting your company, overcoming negativity, pessimism, and getting to the point where I know you all are, because I know you. What would you say to those that are behind you? What did you do to overcome that?
So our company again is a little different because we started making money within the first few months. In order to do that, we spoke to a lot of specialists to figure out exactly how to have our product covered through private insurance. And that's become a core sort of pillar of our business is compliance. So we had to figure out what we needed to do, who we needed to speak with, who we needed to include in the process, and what sort of documentation we needed to show the insurance company that we were compliant in terms of reimbursal. It was very hard. And I think for us, again, we're a unique company in many ways, but cash is always very hard. And, you know, when Alex asked me at my business or at my wedding to start this business, we started it less than a year later. So I went from working at a hedge fund, and my wife had all these expectations of what our life was going to be like. And very shortly after, I was like, you gotta trust me. So personally, that's very hard. You do have to bet on yourself. I will say one of the personal hardest struggles I had was orthotics are not necessarily the sexiest industry. You know, we're not curing cancer, and we're not doing all these things that, you know, if you're at a dinner party, everybody says, ooh, ah. When I say that I have orthotics that stimulate nerves in your feet, you can correct your posture, optimize your gait, everybody kind of glazes over and they're like, oh, cool, orthotics, you must like feet. So that was hard for me on the social side. You know, I had pursued things in my career that in my mind gave me status or prestige or the things that I wanted. And now I went back at age 30, started at the bottom selling orthotics. It was a lot easier because I did it with my best friend and we were kind of in it together. So that was very good. I have a very supportive wife that was very awesome. And if I were to go back and give myself advice or to give advice to those of you maybe pursuing, I would say the first thing I would tell myself is it doesn't happen overnight, even though you think, you know, I've got all the context, I've got all the knowledge, I've got the secret sauce. There are things that inherently just take time and that are out of your control. And the second thing I would say is be nicer to myself at the time, because I didn't hit those milestones 3 months, 4 months, 5 months, 6. We're going into year 5, and our last year was our first profitable year. You know, and in my mind, the expectation is we should be making money, and when we don't, it's on me, right? I'm the finance guy, I'm the money guy. So I would, in hindsight, I would look back and say these things take time. Believe in the mission, have an end goal, and kind of enjoy it as it goes.
Fantastic. And to add on that, there's a lot of examples of the 15-year overnight success. So they're out there, and good on you, Matt, for sticking it out with your partner and getting to the point where you're at. So congratulations. Saumik.
So I disagree with Matt. Orthotics is a pretty sexy space. It doesn't have to be that, it got me interested, but,
Like feet.
yeah. But Matt actually touched on a lot of really great points. I think leading with conviction and believing in what you're working on is the first step. Because that will help you get through a lot of the challenges that come your way in the early days. And the second part is that support network that Matt touched on. I think for me, having such a great co-founding team, so I have 3 other co-founders, again, just brilliant people, working with them day in, day out, it's like almost fighting a war, sort of, that you're in it together in this battle with them and trying to solve some of the toughest problems that there are no real answers to online or in books. So having that support network is a huge component of it. And I think the third part is getting validation from your end users or customers that what you're working on truly brings a lot of value. And I'll explain sort of some of the earlier challenges, some of the challenges I'm facing right now, because as you're sort of progressing through the life cycle of a startup, you experience different challenges at those different stages. So my challenges right now is saying no to investors and not taking their money, which is a nice position to be in. But a year ago, when we were raising our first round, we had a few things that we could work with for our company, right? Because when you're raising investment money, you have to oftentimes show that you're de-risking different components of your business. So whether it's technology, whether it's your business model, et cetera, you have to really convince investors that you have a vision forward and you have all the right steps and the right plan and the right team to move forward. So just to give you guys an example, in the early days with financing, we leverage a lot of grant funding. So we've been around for only 3 years. And to date, we've brought in about $3.6 million, including grants and investments. And 6 months ago, we closed our first oversubscribed $2.14 million round from our investors, all Canadian. But basically, just to give you guys some perspective, I pitched to 205 investors over 2023, which was a crappy time to raise because the market's sort of trash. And I think we had about 15 of those investors convert. So it's about a 7.3-ish conversion rate that we were able to achieve. But that took many, many months of presenting, getting rejected, getting feedback from different people. But it only took a few of those investors that really believed in our vision. And at the same time, we had interest from a lot of top hospitals in the world. And that really accelerated the discussions we were having with investors. And looking at it now, at a 20,000-foot view, just the momentum we've been able to generate in this short period of time has really helped us build the confidence we need to make the difference in medical innovation. And I think because of that confidence, investors are coming to me now, asking if they can put in $1 million, asking if they can put in $100,000, where we're just like, not right now, maybe Series A. So it's just a different set of challenges as you're going through those life cycles.
I didn't know if you wanted to comment.
Oh, I wanted to comment, but I'm gonna restrain myself for now.
I don't know that I can say I also have a foot fetish, but I do think it's very
These jokes
interesting.
every day. So.
Yeah. So I definitely agree with both what Matt and Saumik have already said. And going back to the very early days, answering your question about the struggles, I mean, firstly, if you are the one taking the leap into entrepreneurship, you have to know it is a completely personal decision. You have factors in your life that your co-founder, that whoever you're speaking to, don't understand the way you do because it is your life. It is completely different from what they are experiencing and why they may make a different decision than you. Touching on the capital funding, basically, I mean, we all know it. You can't do anything without money. Whether it's your own or somebody else's, you need money to move it forward. And so obviously that's a big part of it. So I don't know that it was a struggle, to be honest. We kind of came upon this funding, started, and we were very fortunate that our financing was pretty easy. And I know that's not like a typical case, but it was a hurdle we had to make sure that, or something we had to make sure was in place to move on, of course. That support network that, we've already touched on is huge. You may be somebody that needs a large support network, so make sure that you have that in place. Everyone's different though. You may only need like a smaller support network. Again, it's what works for you. What you've seen other people do, what you've seen, all of that, everyone is so different. So I would just say, try not to benchmark yourself against everyone else. It's really great to learn from other people's experience, but know that yours can be very different. And that's okay, because that's your journey. One other thing I want to say about struggles, actually, sorry. Going back to making that decision at that time and, deciding to do it, part of, we've already touched on it, that passion and, when you make the decision to do it, that is what's going to drive you and motivate you through the struggles, the hurdles, and everything. I've had so many conversations where people want to get into business, whether it's because, and probably not a lot of people in medtech, but like other people, like they want to be their own boss or they want flexibility and all that. And, it boggles my mind when someone says, "Oh, can you tell me about your experience? I want to open a business." I'm like, "Great." Like, and then we start talking and it's like, "But I don't know what to start the business on." That's the one thing I can't help you with. Like, that has to come from you. Like, I can try to help you with other things, but that passion is really going to drive you. I'm very scattered with my thoughts right now because there's so much I want to say, but I don't want to forget to say this because for all the women in the room, one thing I did have to face was that. And it's not gone, I have to say, I can't say I've had like terrible experiences, as a female but coming from engineering and fusing that with business, both very male dominant fields. And the third part of it, which reminds me what I was going to say, is that when we started our business, my qualifications were a PhD biomedical engineer, nothing business related. So you better believe I heard it from some people. Some people who may not have thought I could do it, may not have thought I was cut out to be the CEO and co-founder of my own company. Obviously I accepted the challenge. I'm not one to not do it, but I will say, I actually and still believe and would encourage you to, again, with your passion about whatever you want to do, no one is going to know your product project better than you. You are going to drive it forward more than any business person that's going to step in. That's how I took it anyways. And that was, again, it definitely existed. It wasn't a terrible struggle. It wasn't something that for me, I always say you can't change or expect things not to happen, but you can change your response. So, whatever would happen, it's like, okay, that's not going to stop me or alter me from my path. You take that, you carry on, and that's all I'm gonna say there. Not to be all like pro women and whatever, but I had to throw that in there, Justin.
Well, I really appreciate that. And what I have to say is ignorance isn't gender biased.
Yeah.
So I've talked to a number of people and it doesn't matter who they are, they just don't understand the problem that you're trying to solve. And there are barriers out there for many different people, for sure. And those that want to hang on to ideas that may not be valid. They might not have a product market fit. And it doesn't matter who you are and no matter how much you complain, that they just don't understand me. Why am I not getting the bucket loads of money that I deserve to move this technology forward? Which transitions into my next question. So how do you do product market fit for your technology, understanding that you all have different nuances with respect to what you're doing? How did you find it and how did you exploit it? The question that I had before was related to like creating a business plan and getting financing. But I think that you all addressed that already. So all of this is part and parcel of you find something, you are committed to it. But how are you actually finding out if someone's gonna pay for this? And that can be reimbursement and different mechanisms in the healthcare system internationally. It doesn't necessarily have to be a CPT code in the US or being part of the formulary in Canada or whatever. Like, obviously, you have to do some homework to say, I'm creating a crazy robot machine, Saumik, and what the heck am I gonna do with this sucker? And how am I gonna sell it? And I understand your Matt and Asha's technologies as well. So what are you doing to prepare to get into the market, knowing your innovation path?
I hope you don't mind. I'm gonna start with this. Like, I love that because especially as an engineer, I always say, we love working on these cool projects and then we want to just push it out into the world thinking everyone's gonna want it. But, you know, part of like the basis of the fellowship and other programs that exist now, it's like, let's go to the need instead of, you know, but I have to say, there are some pretty cool projects that may not be like, that doesn't mean they're not cool projects, but to your point, it might not be a product that should go out into the market. But to actually answer your question, yes, of course. And I realized that I never said, I don't know how much you guys already know about us, but I never said what our technology is. It's called the Cobra. It is a device that essentially prevents patients from bleeding out in emergency situations, provides circulatory support for cardiac arrest and other applications, but it's all for emergency situations and gives patients support for a period of time until they can get to definitive care. So going back to how did we ensure there's product market fit? Well, as I mentioned, and we've talked about, my co-founder is a clinician. He's a vascular surgeon here at Vic, Dr. Adam Power. So one, I had an end user right next to me the whole time I can always lean on. But you know, I'm sure if you carry on this journey, you'll hear people tell you, you cannot listen to one person. One person's feedback is not enough to move your product forward. Talk to lots of people. We have an extensive network, and so we did that. But I do want to say too is, you know, the problem you're trying to solve in the field. And so when you look at that problem, for us, for example, we're like, well, what are people doing now? And you're targeting what the issues still are, and we addressed those. So that really helps when you go to those customers and they're like, this is what we do. And you say, we have this, and now you've like hit all of those problem points. Like, of course they're sold. I mean, I'm simplifying it obviously, but essentially that's what we did. We hit all the problem points that were currently existing in the market. A lot of times they didn't have anything, and getting customer feedback. Was there something else to your question I forgot?
No, I think that's good enough, Asha, for now. I appreciate your answer, but I'll add.
Yeah.
So you're getting into the market really quickly.
Yeah.
Is that channel partners? You're not selling direct, you're not selling it out of the trunk of your car. You've had to find mechanisms by which to get reimbursed and get your product into market, correct?
So in North America, we sell direct. Now we have actually expanded internationally, if that, just so you know, and we are using distributors for that. But here in North America, I mean, of course, we're not selling out of our trunks, but we have a warehouse, but they're just a 3PL that do the shipping for us. We do our sales direct.
Amazing,
Yeah.
awesome. Saumik, Do you remember the question?
I do.
Okay, good, because I don't.
Okay, it's okay. I was just to say, when you're revenue generating like Asha and Matt, you're in a pretty good position, different growing pains, but very good position. I think there's a couple concepts here that I'd like to sort of deconstruct. So product market fit, my own sort of stance on this is that the market's constantly evolving. And oftentimes what ends up happening is you build a product, you bring it into the market at the time, and certain end users may request for certain features. But as the market sort of goes year by year, there may be new challenges that that market segment is facing, which will basically allow the company to iterate on that product design or that technology feature and basically bring that back to market. So there's a few thoughts here that recently there was an article that came out that talked about why Canadian investors are investing more in US startups and not Canadian startups. And some of the VCs there were sort of describing that the US startup founders have a different mentality where they just want to quickly build something, and then iterate that prototype into the marketplace ASAP. Basically get feedback from your customers, iterate again, and then basically bring this technology that you could sell. And they were saying with a lot of Canadian founders, the issue is we want to make things perfect. We want to make sure it's working a certain way. And by that time, the years have passed by, and maybe you're at an advantage or disadvantage compared to your international peers. So the thing that we did, I think the team did really well, is that when we heard about this problem from London, we interviewed maybe 100 different clinicians around the world, and everyone just kept on saying the same thing, that we use this manual method. It's very inconsistent. So we're like, okay, we're seeing a pattern here. So maybe let's focus in on potential ways we could solve this problem. Rather than, as Asha mentioned, just building a technology without any feedback and just bringing it to market. And people are like, well, don't really like that. I don't want to use that. So what we ended up doing is, again, using a very engineering design sort of framework to sort of narrow down on the potential solutions that would be a good fit for the pathology labs. So that factored in, why are we using ultrasound and not CT? Maybe CTs are very expensive and labs can't afford it, right? So there's like a lot of these different objectives, constraints that we sort of applied to really filter down the potential solutions. And the one thing that we also did is we built a rapid prototype, took it to different hospitals, got the feedback from the end users, and then basically took their feedback and implemented it in the next iteration of our device. So obviously we're not on sales yet, but we're sort of really working towards building this next version of our device. That's our pre-commercial unit, which we'll go through a series of usability testing before we apply for regulatory approvals and start selling. Now, Justin mentioned economics. I'll be honest, we don't have it all fully figured out. But when we're engaging with our clinical partners, what we end up doing is, as part of these clinical engagements, phase 1 of the study would be to look at the economics of the current process. Because when you start selling a product, it's not that we've built the coolest technology ever, it's going to solve all your problems. The biggest thing is really understanding where your customers are at currently. So with our hospital partners, like in the US and Canada, we ask them, well, what methods are you using right now? Are you aware of how efficient it is? So we actually did a whole research study with Mayo Clinic, and we found out that the average error rate was about 50% at Mayo, the top hospital in the world. And in some samples, the error rate shot up to 97%. So this is Mayo stats. There's a good chance that other hospitals are facing similar issues. So we'll be publishing that study hopefully later this year or early next year. But the goal is we're creating a clear picture that here's the current method, the standard. When we build our technology, we'll have marketing or clinical studies that talk about the delta or the performance advancements. And then we use that data for marketing or sales when that time comes. Again, it's to get your customers to really understand and work with you that, hey, let's look at the current problem. Here's how we could potentially help you, and then have them, really buy into your technology. So there's a lot of sort of iterations that are happening during those discussions with your customers.
So I think every year in the business, I would answer the value prop question differently. So coming to the end of year 4, I've actually been reflecting a lot and thinking about what we actually solve. So in year 1, I would have said that we have the best product in North America. In year 2, I would have said that we have the best product in North America and the best service in North America. In year 3, I would say we have the best product in North America, the best service in North America, and we provide access to some of the best specialists in the world. And now we manufacture in North America. And in year 4, I would say all of those things, and we've also created clinical software to make it easier for the doctor, easier for the podorthist, easier for the customer, and easier for the business owner. So we have so many different stakeholders that touch a piece of our business. And throughout all 4 of those, everybody that touches our business has to win. So at the end of the day, the customer has to win. They have to feel like going through our process and buying our product makes a marked difference in their life. The HR person or business owner that allows us into their business to offer that clinic needs to see a marked improvement in reduction of injury or prevention of long-term disability claims. They're paying for benefits that their employees aren't using. So if that utilization rate goes up, they need to see some benefit from that as well. The economics for our physicians that help with facilitate the gait analysis and the prescription process, we had to find a way through OHIP so that that was able to be funded, because if we had to pay for it, there's a conflict of interest, which shoots our business in the foot right away. And finally, on the dispensing side with the podorthist, they're able to see that the methods that we've brought to North America through our specialists are actually superior. Well, I would say superior, and so would many other people. And it's funny, this question, because I worked out with my coach like 2 weeks ago. And what is the problem I'm solving? Well, it's more like what is the question I'm asking? And many businesses ask their customer or their stakeholders different questions. And inherently what we ask is, why wouldn't you? Why wouldn't you take advantage of a clinic that's offered in the workplace? Why wouldn't you use your benefits if you can reduce your chronic pain or perhaps prevent an injury? Why wouldn't you bring a service in for your staff that's, shows you actually care about wellness, health, and safety, instead of, no offense, a pizza party? Or and for the physician, it's like, well, why
are you laughing?
I'm laughing. By the way.
But ultimately, everybody in the chain has to win. And I think if I were to look at each year in a vacuum, that's how I would have answered the question. But the overarching value is that we answer the question of why wouldn't you? And ultimately, you can answer that question with our business now. So that's how I would answer that.
Excellent. And so a lot of what I heard transitions to another question that I think is really important for everybody to hear, and was important in my career, is can you give us a little bit of like personal flavor on the importance of networking and finding partners and people to help out and mentors and some of the support mechanisms that are out there for that? I know from my own personal experience, there wasn't a BioNext, there wasn't a Tech Alliance. There wasn't a lot of support mechanisms out there. You just basically had to beg and plead with the older rich people. Can you give me an introduction or whatever? And I know that you guys have been around a long time, also have benefited from some of these support mechanisms, Mars, the RIC system, whatever it might be. I think it would be interesting for those that are just getting going, that don't know that there's a place where you can find friends that aren't going to judge you. We just want to hear about your ideas and help you, as you guys do. You're doing it now. Can you explain a little bit about your journey with those support mechanisms?
So I would say my network is my superpower, and generally speaking, I'll give some of my rules and strategies about it. But I open this up by saying I'm not an engineer, I'm not a PhD. So by being in this space specifically with BioNext, and we were invited here by Dr. Drankdova and Dr. Holdsworth 3 or 4 years ago. We were one of the first companies. The amount of people I've met even at Western in the ecosystem, and I went to school here. It's amazing because of events like this. Tech Alliance is the same way. One of my coaches is now a vice president of Tech Alliance, but I met her through the growth accelerator that Tech Alliance offers to all of their startup programs for free. There are so many people that want to help you. And entrepreneurship is inherently a culture where we all want to help each other out. Because if I have a contact for Saumik, I would love to give it to him, because that doesn't mean I lose. It just means like he wins. And if that comes back, awesome. But if it doesn't come back, my life isn't worse for having helped out a colleague. And the way I think about it, I romanticize networking quite a bit because I really do believe in it. And the question I would ask you is, when has anybody asked you for help and you said no? That's probably the only time you said no is if you can't help, or if somebody's sort of exploited you in the past and it's sort of a broken record. But human beings like helping other human beings. Like we are social people. And as entrepreneurs, you're kind of even more on that level. We need to talk, we need to ask questions, we need to rely on each other. And I find that a community like this, like I'll speak specifically with BioNext because I work out of here 2 or 3 days a week. I'm able to go ask Saumik a question about an accelerator in Toronto or about an event he went to last year. Get the inside scoop. Is that worth the $1,200? Did you get the value out of it? Those types of things. Saumik walks by and he goes, "Oh, Matt, last week I met somebody. Let me introduce you." And just by being around, and this is one of my tips, is showing up is half the battle. If you go to a networking event, you might think you're going to get absolutely nothing out of it, but you have no idea who you're going to bump into. And this is rule number 2, is I don't sell at networking events. I just go and try to meet people, and you try to meet people and you network, and maybe if you hit it off with them, then you have a coffee a week later, then you kind of talk shop, and then you can get into the weeds. But I find that as a superpower. If you don't sell at a networking event, you don't get people on their back, you just go and meet people. And I've stuck around London with my incubator. So I did BioNext. We were fortunate enough to do Morissette. We're Tech Alliance members. And yes, we are of the other ecosystems, but I live here, I'm married, I have a 1-year-old. I'm not going to be in Toronto 2 or 3 nights a week. So I would say networking it's not even a nice to have, it's necessary. And if you don't like networking, get a co-founder that does, because they say a rising tide lifts all ships. And that's like kind of what entrepreneurship is, and networking. So I can't speak enough about it. With that said, if you want to reach out to me on LinkedIn, I'd be more than happy to help you or have a coffee, because people have helped me in my life, and you know, I can never pay it back, right? So if I can help you answer some questions, have a coffee, I'd be more than happy to. So
Thank you, Matt, and you've always been a big supporter of us, and we appreciate you being here tonight.
Thank you, Matt and Asha and Justin. Matt nailed it right on the head. Like, networking, if it's not your superpower, I highly recommend something that you can either practice on, or as Matt said, maybe find a co-founder that's really good at it. Because I think from where we are right now, we were able to benefit quite a bit from this extensive network that we've been able to build out. I think honestly, looking back, I think we're part of 20 plus different organizations. And it's gone bad to a point where the Toronto Star calls us a Toronto company, even though we're in London. Just to give you a context of how many different organizations we're a part of. But the thing you end up learning is you meet individuals in these different ecosystems. As Matt said, they're willing to help you, right? And my biggest thing with networking is, like, I usually go in, I don't have any asks. It's just to meet them as a person and build that genuine relationship. Because that sort of philosophy pays huge dividends down the long run. Because with our investors, for example, when they invest in you, they're literally trusting you with their money. So there's an element of trust that needs to be built out during these networking events. And oftentimes when you're meeting with individuals, you learn about their personal story, their life, and eventually you'll have more interactions down the road where eventually you can ask for, like, hey, like, I'm looking to learn about this particular thing. Do you have any recommendations or someone I should speak to? And that's something that we've really leveraged quite a bit over the years, where, you know, I'm not an expert in regulatory or engineering or building medical devices and bringing it to market. So we spoke with a lot of successful entrepreneurs that have done that successfully, and be able to talk to them through these different incubator accelerator programs. So that's a really important characteristic. As you sort of go into these different communities, you start meeting really interesting people. So I met Kevin O'Leary, I think 2 weeks ago. He's a very interesting fella. Again, I had no asks, but you learn a lot about a particular individual. But, you know, as you start working your way up into these different communities, you meet people, and eventually you have an alignment with certain individuals, and you want to keep them close. You know, I think that's a really big thing. Aside from that, I think, Matt, you summarized it very nicely.
Thanks. Yeah, that was great from both of you. I think we touched a lot on networking. I agree with everything they all said about networking and building primarily relationships that have nothing to do with your business. At the forefront of that, relationships are key to everything you will do in your business on every level. Cannot stress that enough. It's all about the people and how you are with them. I do want to touch a little bit more on the mentor and advisor side that Justin asked about. I have always really valued my mentors and advisors. You know, we can learn by experience, which is, I've done a lot of that myself, of course, even through this journey. But if we can learn from other people's experiences who have already been there and done that, we're that much better off. And again, it may not align completely, but they want to help, as we talked about, probably no one's gonna say no if you want to talk about how they fared, like going through some experience you're about to. Um, you know, actually, this is, I'm gonna take this opportunity to talk about a mentor and advisor I had in grad school. I think he's still here, Dr. David Holdsworth. Did he leave? Yeah, oh, he's here. Great. I was fortunate enough to have Dr. Holdsworth as an advisor during my PhD. And I'll tell you, to this day, I walked in and saw him, and I literally to this day can remember specific conversations that I still think of to this day. Like, that is an impactful mentor, advisor in your life. I mean, he's done a lot more. Just as a side note, I have to say this, he actually started, he's the reason why the Medical Innovation Fellowship started, and he's also the reason why I got recruited into the fellowship. So a lot more to say there. But again, I want to go back to, he wasn't my only advisor. Part of this type of relationship that is, I think, is so important, and I want to tell you about, is you being yourself. And people always talk about authenticity and being authentic and all this stuff, but I'm telling you, this is one space where it is very, very important for many reasons. If you're putting yourself out there as someone you're not, we've all felt it. You walk into a room and you connect with certain people way quicker, way easier than you do somebody else in the room. We put out our energy and you align, as Saumik said, with certain people, sometimes instantly, sometimes, whenever it is. But that alignment is key because you are drawn to them for a reason and you will work together well for a reason. And if you carry on that relationship, as you probably will want to if you're, drawn for some reason or another, that is going to come out and impact your business decisions. You don't want to be connected to someone who you're not aligned with and then move forward in your business and be relying on them for advice going on. I think you all get it, but it is very, very important. And I can tell you, in frontline, even at this stage in our journey, we still have mentors, we still have advisors, and some of our advisors have gone on to become, board members. So that's the one thing I want to say is, rely on them, don't overburden them. I mean, I know, sometimes when we need something, we can be a bit pushy, which is fine. I mean, probably if we've gotten to a certain point in the relationship, it's fine. But, rely on them and try to learn from their experience and be yourself when you're networking. Like, really put yourself out there as you so that you can connect with the people that will truly help you. I'll stop there.
I had one thing to
Yeah.
that.
Yeah,
So I agree, absolutely. I wanted to say it's very hard for me to admit that I don't know everything. I went through business school. I worked in firms where not knowing was a sign of weakness and you got preyed on. So even if you didn't, you've heard fake it till you make it. Like that's like driven into me. So it's hard to go to a networking event and to knock those walls down and actually be vulnerable, which is why you got to keep going. Like you're not going to knock it out of the park the first time. You got to keep going. You got to get better at it. So it's like a muscle. You got to work it out. So I agree completely. But I wanted to share, like, it makes me feel uncomfortable, even though there's a utility to it. I have to recognize that I'm human, and it's not easy to admit you don't know things, so. Sorry to one up.
No,
So
I like that.
just before I open it up to the floor for people to ask questions, I have one last question. And then I'll wander around with my microphone so you can ask. What would you do differently, knowing what you know now? And what keeps you going?
I'm gonna give it to you first. We've always started on the end. so I thought-
Yeah, of course. And obviously put Saumik on the spot every time.
It's a really good question, Justin. I don't know if I'd do anything differently, to be honest. I think to my younger entrepreneur self 3 years ago, what I would have told myself is that not everyone has their SHIT figured out, even successful entrepreneurs. Because sometimes they may be operating in certain markets that they understood, but sometimes that same framework of logic may not apply in other markets. So basically, knowing that it's okay to have different perspectives on certain approaches from even successful serial entrepreneurs. And I think the second thing is just really really betting on validating the problem that you're solving and getting testimonials from your customers right off the bat. And I think I'm just thinking of all the challenges that we were going through in the early days. And a big part of the momentum swing when we were raising our first round was getting credibility from these top hospitals like Mayo Clinic, who believed in our vision of our product. And I think having that validation in the early stages of our funding round really propelled this ID GAF mentality. I won't, for the young kids or the Gen Zs here might know what ID GAF stands for. I won't repeat it, but it really boosts the confidence that you have, knowing that what you're building is going to have a huge impact on society. So that's sort of the mentality that I had going in. Even if some investors were saying no, maybe not right now, that's okay. You get feedback from them and you iterate. So I think in a nutshell, those are probably the 2 points that I would probably reassure and tell myself, younger self, if I have to do it again. And again, the same holds true, just finding the right team, which I'm very fortunate to have that right off the get-go. Yeah.
Same, I don't think I'd change anything because I've learned so much by making so many mistakes. One of the blessings in disguise we had is yes, we started selling early and we started making money, but it was in a COVID environment. So we go to factories and in Ontario, we were a risk, right? If we went to factory A and then factory B, we could potentially be a super spreader. So we went to Alberta because COVID didn't go there. And we were able to start. But because we had those initial constraints, upfront costs, we weren't able to really go at it as hard as we wanted. We had to start small. By starting small, we failed small. By failing small, we were able to learn and optimize and continue to refine and make ourselves better. If I were to say something to myself, or if I could go back and coach myself, it would be, I really struggled with being a CEO of a medtech company without necessarily a scientific background. And through the years, I realized that I knew what I was doing. I know how to run a business. I know how the finances work. I might not know the intricacies and nuances. That's why I have a co-founder that, honestly, if you saw him, I think he might be back there. He might be in the lab. If he wasn't 6'5", he'd be an astronaut. Like, the only reason he's not is because he's a freak of a genetic specimen human being that won a gold medal. So by really leaning in, and I will say, like, Alex told me this. I remember one time he put his hand on my shoulder and was like, dude, you got this, like, just go. And if I would have started day one with that confidence, I think we'd be even farther ahead than we are now, than realizing that kind of middle to end of year 2. I had a lot of self-doubt and I maybe relied on external validation more than I should have. And then when I got it, then, okay, now we're off to the races and we can run with it. And again, I'm human, like we all have to, grow. But if I could go back, I would say, you're onto something, you know your business better than anybody else does. Just do it. And if you make a mistake, like just just keep going and fix it, as long as it's not a terrible mistake, which thank God we've never made. So that's what I would say. And obviously you guys have done the first step. If you're here, it means you all want to be entrepreneurs, or you've got it in you. You might not know exactly what you want to do or how you're going to do it, but like I said, and I don't mean to be cliche, like showing up is half the battle. You're here. Everybody at BioNext, at least I can speak to, would help you, would have a coffee with you, will help you formulate that MVP or that business plan or whatever. And so if you were me, I would ask you, why wouldn't you?
Thanks for that. And my answer is going to be no different from my colleagues here to say I wouldn't change anything. Like I truly wouldn't. Of course, you know, there are ups and downs. Everyone talks about the roller coasters of entrepreneurship. They're definitely there on many levels, but you know, I wouldn't change it. It's all part of our journey, my journey, and the company's journey, you know, and why we are where we are today. If I could go back, you know, everything that they've said already for sure. I think part of, and I want to say like, I would say that, but I did say that, like all these things that we're saying, it's like, you know, and partly again, coming from not having done this before ever, it's like you don't have to know how to do everything. And I think that can be very intimidating, again, without doing your MBA or having a business background and you're trying to start a business, you know, but telling myself, you don't have to know everything. You just have to be willing to figure out how to get it done. That's it. That is what's going to make you succeed. I did not know how to do everything, but you know, you talk to people, again, talk to your mentor, support network, people around you, you contract out some of the work, you learn along the way, like however it is, you're gonna find a way because you're so passionate and motivated about your project, you'll find a way through. So, you know, don't be intimidated by what you don't know. I think I'll end there.
Thank you, and I just wanted to open it up to the floor, and apparently we have ceiling microphones, so you don't need me to wander around with the mic. So if there's anybody who wants to get some questions off the ground for there you go.
Hi, I did have a question. One of you answered earlier, I think Matt. So someone asked if you could go back, not this actually recent question, but earlier on, and you had mentioned that you would reassure yourself. So I've been getting that advice a lot. A lot of university students get it a lot, especially when they're not sure what they want to do after graduation. And I want to know honestly, if you feel like that anxiety and fear of failure had to do with how successful you are now. Like if you didn't have that drive, do you actually think you would be as profitable and successful as you are now?
First of all, fantastic question.
Yeah.
I think,
Summarize it a bit.
oh, you can hear?
Microphones, but they only work.
For the live stream. So what was asked was going back and reassuring ourselves in the early stages, but did that fear and anxiety of failure drive us to where we are now? So the easiest way is to say yes. Again, I'm unique to my other colleagues. I got married less than a year before I started this business, which means my wife bet all of her chips on me. Secondary.
Mistake.
Justin said big mistake if you didn't get onto that. But secondary is my childhood best friend also made himself very vulnerable and asked me to start it, and he bet all of his chips on me as well. And that's a lot of stress and anxiety to carry. And there are certainly nights where you lie up and you're like, we have a $10,000 bill coming in 3 weeks and we have $600 in the bank account. All I need is for this company to pay their invoice, which is already 2 months late, you know, and so what do? Well, you go make that 10 grand anyways. And if they both hit, they both hit. And if they don't, then you figure that out too. But I would say, let me put it this way. If somebody would have written us $1 million check day one, we would look completely different right now. Would we even be here? I don't know. It would have been nice, it would have been a lot easier of a learning experience. But I do think like a decent amount of healthy fear is good, or anxiety, right? And it's like what makes you get up in the morning. So to answer your question again, very, very high level, yes, the fear and anxiety is good, and it has driven me, and I would say us to a large extent to be where we are now.
Do you mind if I add something there? I just want to give the other perspective, because not to say I had no fear and anxiety. Of course, I also agree that a healthy level, like, can be good. But I think how you, again, the different circumstances that surround you at the beginning that we talked about, your personal, like where you stand when you make the decision to become an entrepreneur, your support network, and the reasons why you may or may not be able to do it make a huge difference in that fear. For me, and this is the example of the counter, is that I knew we had enough funding and I was okay with my support system to get us through 1 year. If we failed, I was gonna go find another job. Okay, great. Like, there was not a lot of fear of failing with that project. You see what I mean? But like, of course, you never want to fail. Like, again, that's where the healthy level comes in. But again, I think, however you're kind of set up, or you set yourself up and make sure, okay, I am going to be okay for X amount of time, and you're okay with that. I think that will help with that, but what you will be driven by. And again, as I was listening to this, it's like, I was still like, I'm so driven by the project itself. Like, that's what's gonna like do that. And then you have the balance of everything else that kind of plays in. But I just wanted to say flip the coin and say, it's not always the one thing that really drives you.
I might add in actually.
Yeah.
I wanted to clarify one thing. Fear of what?
Fear of failure.
What's the worst that could happen?
Yeah.
You lose all your money and then your 1-year-old doesn't have food at night.
Fair. That's a fair, yeah.
But I wouldn't have. I wouldn't have done it if I didn't believe I could. That's the other side, so.
Yeah, but that's the thing, like, in Matt's situation, when you have a wife and newborn, that's stressful as hell. Like, there's no way to, make that a more simpler case. In my situation, I was single at the time. I have my family close by, right? So the risk criteria is a bit different for each individual. But if you don't have, let's say, a child, or, if you don't have to depend very heavily on your finances, the mindset that I usually am in is how do I de-risk these different areas of failure? Because for me, I don't see it as failure. It's all learning for me. And as Asha mentioned, like, one thing Mike and I always talk about is failing upwards, right? Like, you learn so much in entrepreneurship, like stuff you won't get in any other corporate job. But as you're going through these phases or these different task activities as an entrepreneur, you learn those things right off the bat. And they're actually, Harvard did a study recently where they said failed founders actually end up getting paid 3 times more than those who have stayed in corporate when they go back to the real world. Like, when failed founders go back to corporate jobs, they actually have a 3 times higher probability of getting paid, much higher than their colleagues who stayed in corporate. And the reason for that is because as entrepreneurs, you just learn, you dip your toes in everything, right? So there's sort of, like, for me, again, I have more of this like open mindset, or more of like a proactive mindset, where it's more like, what's the worst that can happen? Yes, maybe if I have children, obviously there's a more of a emphasis on the financials, but maybe I can apply for grants that can help subsidize whatever amount of funding that I may need, right? So there may be certain approaches to that, and it just depends on your risk profile, right? And I think it's a huge part of it, right? Go ahead.
The deal is never done either. So the failure is not a finality. It just means like you just go left or right.
Thank you.
Great question. I also feel if you're given an opportunity with whoever, whatever, feel it out. make sure you're comfortable with it, but learn from it. And what do we like to say, Colin? Recycling of human capital. Get experience, get involved with a project. It might not be the blockbuster or the billion-dollar thing, but get experience. I won't tell you all the failures I've had, because I've only had successes. Any other questions from the audience? Yeah, what?
So I'm not sure whether this question fits the forum, but this problem has been bugging me for a while now, ever since I've landed here. So I thought might as well take a shot at it. We all know that the wait times here in Canada are quite long in terms of access to healthcare. And of so many people that I've talked to, most of them have often told me that it's a government issue or a policy issue. So I wanted to understand, but then for some reason I don't buy this reason. I just want to understand from your lens, do you think like this opportunity for young entrepreneurs to go ahead and do this issue, trying to reduce the wait time at some level? Or do you think it's in the ball in the government's?
So the question was policy procedures in the healthcare system as we utilize it. We go to a merge, how long do we have to wait? Are there things that we can do as entrepreneurs to fix that? Is that basically the question?
Yeah, so.
I don't know the answer to that.
Well, I would say access to healthcare is a huge problem in Canada. So the stat I would give you right off the bat, which affirms what you've just said, is only 1 in 6 people in the GTA have a family doctor. During COVID, you were able to use telehealth, and physicians were able to bill the same amount to OHIP for a telehealth visit as they were an in-person visit. Policy changed a few years after that, where a telehealth visit only bills at 17 versus 37. So all the telehealth clinics closed, and physicians just went back to their walk-in clinic model. What happened was that people that didn't have a family doctor couldn't get into a walk-in clinic, so then they were going to the ER for things that weren't emergencies. They needed healthcare, and they needed access to healthcare, and that was the only way you could get it. So yes, there are so many opportunities, and there are creative opportunities and creative ways that you can provide access to healthcare for these more outpatient type services or for things that aren't emergency or ambulatory care. And I think it's an ocean of opportunity and possibility. I mean, we have tapped into that on the Class 1 medical device side, but there are so many opportunities, and you've identified a real need in Canada right now. So yes.
I'll just say I agree. There's obviously a need that I'll stop there, that somebody definitely could tackle it. That was your question, right? Like, I think, I don't know what type of solutions there'll be, but
The opportunity is there.
yeah,
Yeah,
huge opportunity.
yeah, and Asha and Matt described, like Matt said, a sea of opportunities. I think the first step is really trying to narrow down what exact opportunity. Justin led with the example of ERs, but which wait times are you referring to? MRI wait times? Is there departmental specific wait times? So I guess my first step or first approach would be to sort of narrow down what particular wait times you'd be interested in and start interviewing the clinicians, the nursing staff, administrators, trying to really figure out what the core problem is. Because I have a few colleagues in Kitchener-Waterloo who are trying to automate MRI wait times, like using AI, like auto scheduling. And the reason for their company was because manually doing this is super inefficient, which can lead to inefficient scheduling. And in our example, the manual search process could take several hours to complete. So if you have a device that can help automate that process, there is a likely chance that the turnaround time on the pathology reports might be shorter. So those patients can get their reports hopefully at a faster time, so that treatment decisions can be made, again, within a reasonable time frame.
The other sessions will suss out like what those opportunities are, right?
Yes.
Did I misunderstand? Are you looking to do this yourself?
Yeah, I mean, if I stay longer for here, like definitely I would like to address this issue.
So come to like the next session and they'll tell you which one to do.
And the series is up right there, so, and it's on our website, so make sure you sign up.
Oh, yeah.
I
would
think,
have-
in the interest of time, we probably have time for 1 or 2 more
I'll
questions.
talk to you after.
And of course, you can talk to all of us afterwards. I don't know who was prioritized here. You guys were like a tie. You go.
Sure. I just wanted to say, as an undergraduate student, I feel like being an entrepreneur is such a far-fetched idea. So what would you say in terms of like taking initial steps towards like medtech innovation and like what exact like project development ideas and where to start from just basically on the science side of things?
So I'll try to reiterate the question. As an undergrad, and you're trying to figure out, you want to get involved in this space, and you're inspired by it, I'm assuming.
Yeah.
What are your stepping,
Yeah, like
like, where do you start and where did these people all start?
yeah, like at this age, what would be the ideal?
Yeah,
thing to do?
100%. And I would just say, step one, you've already accomplished it. Check mark, you showed up today. Being present is important. So good for you, but I'll let them answer in their own words.
Do you mind me asking you what program you're in?
Yeah, so I'm in medical biophysics.
Okay, great. I'm just curious. I want to say that, of course, like you're here, that shows some initiative already. You're doing that. Things have come a long way, even since, we've been in school. I've been in school for sure. The amount of programs and opportunities surrounding entrepreneurship as an, opportunity beyond school, I think they've really expanded. So I really like that. Use these resources, build your network. We talked about networking, all of that. And I asked about your program because I don't like, you might have an idea of your own. You might network and like we've spoken about today, also meet someone who you might be really inspired by their project. Like, I've also had that, like sometimes you're just talking about a project and you can be that much more passionate or that as passionate about someone else's idea and get into it as your own. But you'll have the opportunity to do both if you're expanding your network and meeting people. And then I have to say, I had the best experience with the Medical Innovation Fellowship. I think it still exists. Okay, so I don't know if it still exists, but there are other
We're working
programs.
on it, Asha.
Okay, good. And it still exists in Minnesota and it still exists in California. There are other programs too. Not that I want you to go elsewhere, but there are so many things that you can do and like lean on your resources is like a big thing I would say. I don't know, like right now, like do you guys have any like elective options or something to do with that, like business stuff?
Not in terms of business, but there's a lot of hands-on opportunities with like lab courses and being able to explore the lab setting and going into like clinical versus like engineering settings.
Yeah, so yeah, like in my undergrad, we had like one business course. It was nothing to do with entrepreneurship and all of that. But to your point, you can start doing more things that will lead you towards that. Even working with a supervisor. Do you have a supervisor in undergrad or no? It's just courses.
With like lab courses, like
Yeah.
thesis courses.
Yeah, I mean, I would approach someone like look into the areas of expertise for like people that you might want to work with. I always say like they'll interview you, of course, but you should also interview them. Make sure like the projects that you're going to work on are something you want to do. And you can they're all on the website, all the faculty, and you can see and if the research interests align with yours, I would say go talk to them. They're not they're not gonna say no, like say, hey, I'd like to have a, opportunity to speak with you, potentially, work, and you'll be working as an undergrad student. It's like extra help for them. You get, experience. So there are many ways and let's definitely connect after. Also happy to connect with anyone on LinkedIn. I meant to say that when Matt did and I forgot.
Okay, so specifically, in the interest of time, but this is specific to you and anybody else that's in undergrad. The new Schmeichel building for entrepreneurship just opened like 2 weeks ago. There's the Morset, like there's like drop-in hours and they have coaches there. So you could ask. Nick Fox is probably, I would say which I can give you his name after. But also every faculty is receiving funding for entrepreneurship initiatives. And I would imagine that yours is no different. They're doing social sciences, humanities, kinesiology, but that's new. It's 2 weeks old. And at Western, we do a really bad job of communicating things. So I would look into that because there is certainly, well, not certainly because I don't know for certain, but there's most likely funding opportunities courses, programs, things that you could lean into. So that's what I would, if you go ask them at the building, they'll be able to help you or anybody else.
Including this program. So,
This too, and that was Justin just beat me to the punch. Exactly, these types of competitions, Proteus competition, there's a good one in Hamilton, Synapse competition. But again, these are sort of types of events that allow you to work with others in the team and try to come up with a particular innovation for a certain problem. So it just allows you to work with others and sort of see what that process is like. Asha mentioned, like if there's classes you could sort of do co-ops or internships with, that's also a great opportunity, but also looking into different accelerators, incubators. They have programs that help shape that entrepreneurial mindset. And that you can sort of determine afterwards if it's something you want to pursue afterwards. There's a really good program in Toronto called Next 36, where they pick the top 36 entrepreneurs in Canada. But it just allows you to sort of network with other entrepreneurs who are looking to do something but haven't figured it out. And sometimes what ends up happening in those programs is those entrepreneurs, they came in with an initial idea, completely fail, but they met the right people through that program where they decide to start their own businesses after. So as Asha mentioned, networking is a great part. And as Matt mentioned, showing up to these events is like the first step. So what you're doing is you're on the right track.
You'll know when there's a project that has taken you and you will feel it, that you're, willing to invest more time and all of that. Sorry, I thought I could yell loud enough, but apparently not.
Asha said, you'll know when you fall in love.
Yeah.
One
Your
last
project.
question. Sorry, yeah, with your project.
Yeah, I was just gonna ask, what's the next big thing for each of your companies and also for yourselves personally?
Okay, so like I said, like we started, we failed small, we've been iterating and building. We've now developed a piece of technology that will allow us, instead of viewing and assessing anywhere from 40 to 60 people in a day, upwards of 300 a day. And that is all Alex and his software team. What they've built is a web-based app that is deployable globally and will allow us to take in intake data that you can harvest from your own cell phone. So rather than having to use all of these expensive pieces of equipment for diagnostics, you'll be able to use something as simple as your phone in your pocket. And we'll be able to democratize our technology and scale ideally very rapidly.
So my next biggest thing is actually working with you. He's actually one of our Ivy interns. So
Nice.
but no, for us, I think at a higher level, seeing the next version of our device being developed. So that's super exciting. We engage with the California manufacturers. I'm looking forward to that. Mike's looking at me with his eyes. Yeah, he's excited too. Yeah, he's pumped up. The second part is sort of going through this whole FDA regulatory process. That's going to be a huge learning experience for us. So I'm excited for that opportunity to learn. The third one is I'm really looking forward to Series A. That's going to be a fun round. We'll see how big that round is, but just with all the interest, it's going to be a fun challenge. Personal development, I try my best to balance time as much as possible. Because the one question about anxiety and stuff, I feel like for me, I don't feel anxious, but I oftentimes may use maybe it's anxiety, I'm not sure, towards opening up our opportunities of luck. So that may mean me working crazy hours, which my team may describe. It doesn't feel like work to me, but point being is I'm just looking for that personal growth and trying to balance as much of my personal life as well with what I'm doing right now. And I feel like I'm getting good at it right now, despite the crazy schedules, and also working with a massively growing team too. That's going to be a fun balance as well.
Global domination. No, I mean, I joke, but global expansion really is the next thing on the horizon for us. I kind of mentioned, I think that we started in North America, Canada, US. We just went into Europe. We haven't announced, but we got Australia. We're literally expanding worldwide. So, I think just truly getting this out to be accessible for as many patients as possible, like that is our mission. And, I mean, do I think we can, and we're going to continue to do it. We may end up getting a partner that has larger channels and quicker ways to get it to patients or something like that, but that's like the big thing for our company. On a personal level, honestly, once you start doing this, if you guys you'll like, part of the problem is having too many ideas to work on, you know, and so it's the next project that is the thing, you know. I can't get, I'm stuttering because I want to say more and I can't. So, but yeah, you know, I think on a personal level, I think it's hard. I will say this, that, you know, it's like your baby, right? Like and so, you know, there comes a time where you may have to part with your baby. And I'm not saying that time's anytime soon for us. I have no idea. You never know when it's going to be. But I still don't know that I'll ever be ready for it, but I think that is part of the journey as well, right? And then a very important part of it, and especially, again, I keep on telling myself, and, you know, we talk about it in the company, we have to keep our eyes on why we're doing this, and it's to get it to all the people. And if that is what's going to do it, well, that's the answer.
Fantastic. Well, that kind of concludes the panel. I've got a few gifts for panelists.
We're not strangers, we don't need gifts.
It's really important that we get them. And just as a side note, Matt's partner, Alex.
Yeah, yes.
I think he's back there. I told my mom that I lost by only 2 points at ping pong to a Canadian gold medalist at the Olympics, but she never asked what sport. So I'm still 2 points away from you in ping pong, Alex. Anyways, thank you everybody for coming. Thank you to the panelists.
Thank you.
Always appreciate you guys. Love you. Here's the other series. If we could just put up the slide, the last slide that has the link. There we go. BioNext. You can register for the other events. We're always around. If you have an idea, it's not flushed out. You're just trying to figure out what your next steps are. You go to the BioNext website and just join us. There's a link to join us. Tell us what your idea is, and we will reach out by either myself, Barbara, or Tom. There he is, Tom. And we will try to do the best we can to help you move your ideas forward. So again, much appreciated. Hang around, mix about. Colin's a great resource. Maria, David, great resources. And I think there's still some pizza left, if I'm not mistaken, so you can stuff some in your pocket or whatever. All right, thanks so much.
Thanks, everyone.